Hello, everybody. Welcome to Miss McGuire video lectures. And today we are covering the peripheral nervous system. So this is the second video. I already recorded the first one when I covered the central nervous system, and I'm using OpenStack's Anatomy and Physiology textbook. So let's go ahead and begin. We know that nervous system is divided into central nervous system that includes your brain and the spinal cord, and the peripheral nervous system, or PNS. Now, the job of the peripheral nervous system is to receive sensory information, send it to your central nervous system. Central nervous system will integrate this information and make decision what kind of response is needed after the sensory information is received. Maybe no response is needed, but maybe you want to do something about that sensation that you are getting. Then central nervous system will send signal to your peripheral nervous system, and PNS will communicate with your effector organs to produce that response, right? That's why peripheral nervous system is divided into sensory or afferent division and motor or efferent division. Now, the sensory division, it's not shown over here, but it also has somatic sensory and visceral sensory division. So somatic sensory division, it kind of like, that's the information that reaches your consciousness. It comes from your skin, your muscles, your joints, right? And you understand the sensation. It also can come from your eyes, from your mouth, right? From your tongue, so taste, vision, smell, hearing, that all of this is gonna be somatic sensory, right? So let me kind of add over here. So we can have these two arrows here, and we can say somatic sensory and visceral sensory. And visceral sensory, that's the sensory information that usually does not reach your consciousness and comes from your visceral organs, right? Like, let's say, from your heart, from your blood vessels, from your stomach, from your GI tract, right? From your urinary bladder. Oh yeah, some of this information from urinary bladder will reach your consciousness, like you understand you want to go pee, right? But let's say you have lots of sensors that sense your blood pressure, your oxygen level, your glucose level, right? So all this visceral sensation will reach your central nervous system, but most of it you will not be aware of, right? And then the second branch of PNS is a motor or efferent division. And motor efferent is divided into somatic and autonomic, or ANS. Somatic means your effector organs gonna be skeletal muscles. So you can produce response that you can control. It's your consciousness response to a stimulus. Autonomic nervous system, effector organs gonna be smooth muscles, cardiac muscles, and glands. And this will be done subconsciously. So you cannot regulate your heartbeat, your the rate of your breathing, or you cannot regulate, obviously, your sweat glands, right? So that's gonna be done by ANS. And ANS is divided into sympathetic division and parasympathetic division. I remember it this way: you need sympathy when you're under stress, right? So that's your sympathetic division. So that will act under stressful situation. And it's not only when you like kind of emotionally stressed out, it can be just increase of a temperature, right? Something that puts stress on your whole body, right? Like, or you exercising, for example, that's then your internal organs will be controlled by sympathetic division. When you resting, when you're not under stress, then your heart, your blood vessels, right? I think blood vessels, there is always exceptions. Blood vessels are controlled by sympathetic all the time, but your digestive tract, your heart will be controlled by parasympathetic division. So we call sympathetic division fight or flight response, and parasympathetic rest and digest, right? So for example, if you're exercising, you want more blood flowing to your skeletal muscles, you want more blood flowing to your heart, you want to increase the heart rate, right? It will be increased, or you're gonna breathe more intensively, so a respiratory rate will goes up. But when you just had your dinner and you're sitting and resting, then you want your heart rate to decrease, respiratory rate goes down, right? Blood flows to your digestive tract instead of your skeletal muscle. Then this will be controlled by parasympathetic division. Okay, so let's look at some vocabulary over here. So it tells you what the ganglia is. And on the top over here, you see a spinal cord that is part of central nervous system. Then we have two roots, right? We have ventral root and we have dorsal root. And those roots come together to form the nerve, spinal nerve. Now, in a posterior root or dorsal root, you have like this structure shown here below, and this is called ganglia. So it's a dorsal root ganglia or posterior root ganglion. And if you look inside, you will see a lot of these cell bodies. So those are cell bodies of sensory neurons over here. So the ganglia, by definition, is a collection of cell bodies of neurons outside of the central nervous system, right? So that would be a ganglia. So neurons with sensory endings in the periphery, and those are unipolar cells. So the ones that look like this. So you have a cell body and you have like two processes. Right? So this cell body will be found inside this ganglion. And you can see peripheral process and central process. It's nice here, like look, one process and another, right? And peripheral process goes to your peripheral part of your body, like to your skin, for example, and central process will go toward the spinal cord. So cranial nerve ganglion, so cranial nerves, we have spinal nerves and we have cranial nerves. So cranial nerves also will have ganglions. They are associated with cranial nerves. For example, trigeminal ganglion. That's a ganglion of trigeminal nerve. That means this is where the cell bodies are found, right? Of the axons that form this trigeminal nerve. Okay, now, what is plexus? So that's again our vocabulary. Plexus is branching network of intersecting nerves, composed of afferent and efferent fibers that arise from the merging of the anterior rami of spinal nerves and blood vessels. Kind of like, okay, let me see, what is, if I have a, okay, let's look at this picture before, and then we'll go back. So we see the spinal cord, we have two roots, right? Ventral root and dorsal root. And then we have the spinal nerve right here. So when they come kind of together right there. And then look, the spinal nerve is gonna branch immediately into two branches. And it's gonna be ventral ramus over here and dorsal ramus. Ramus means branch. Right, so, and then this ventral rami, not all of them, we will talk about it, but most of this ventral rami they will interlace with each other. So they will kind of like make this the whole network that is shown right here. So for example, we have shown here C3, C4, C5, C6, C7, C8, T1, right? And all these ventral rami, ventral branches, they form this intersecting network, and this is called a plexus. And plexus will have both efferent and efferent fibers. That means plexus will have sensory and motor axons, right? There are 5 spinal nerve plexuses, except in the thoracic region. So you do not have plexus in the thoracic region, but you have in the cervical, in the lumbar, in the sacral, right? And then we have autonomic plexuses as well, many of which are part of the enteric nervous system. That is a system that supply nerves to your GI tract, right? So those are plexuses. Nerves are bundles of axons in PNS. They covered by connective tissue, and within that connective tissue, you also will find blood vessels. This connective tissue covering has different names, right? Like, let's look at this endoneurium first. Endoneurium surrounds individual axons. So you have axon, right? It will have, obviously, if it's myelinated, it will have myelin sheath, and then it will be surrounded by connective tissue called endoneurium. Now, many of these axons together are gonna form fascicles, and fascicles will be surrounded by perineurium, and then entire nerve will be surrounded by epineurium, and inside we will even find blood vessels, right? So that's gonna be our whole organ and nerve, right? It's similar to your muscles, because muscles will also have individual muscle cell, then we have fascicles and we have whole muscle, right? That's similar with the nerve. Okay, now we have cranial nerves and we have spinal nerves. We have 12 pairs of cranial nerves. Now, cranial nerves, they can be pure sensory. They only like have sensory axons that carry only sensory information, like your optic nerve. Optic nerve only carries this sensory information of vision. Some might be only motor, right? So let's say the trochlear nerve, right? Oculomotor nerve, those are motor. And some can be both, like hypoglossal, number 9, right? It has both sensory and motor fibers. When we're talking about spinal nerves always have both, and this both called mixed. So we have sensory nerves, we have motor nerves, and we have mixed nerves. When we're talking about cranial, when we're talking about spinal, they all are mixed. Now, cranial nerves are called cranial because they are attached to the central nervous system at a brain level. Most of a brain stem, but it's still brain. Spinal nerves, they attach to central nervous system at a level of spinal cord. So if they attach to brain, we call them cranial nerves. And you can see they're giving names and numbers. Like this first is olfactory, number 1. Then we have optic, 2. Then we have number 3, where is this? Oculomotor. Then we have 4, trochlear, 5, trigeminal, 6, abducens, 7, facial, 8, vestibulocochlear, 9, 9 is here, glossopharyngeal, 10, vagus, 11, hypoglossal, and, 11 accessory, and 12 hypoglossal. right? So that's the cranial nerve. And again, we have pairs of them, and they have names and numbers. So this kind of like a summary, very quick summary, because often we spend so much time teaching students about these cranial nerves. I don't know how much students remember, but this is just a really brief summary, like olfactory. And another thing, if you look over here, we have sensory shown with red and motor with blue. So you can see some are just red, some just blue, and some, right, like over here, that is 7. That's both red and blue, or 9. Red and blue, or 10, red and blue. That means that carry both sensory fibers and motor fibers. Now, pause the video and read the slide, and that kind of like will tell you what these nerves are and their major function. I want to just mention this vagus nerve, because vagus nerve is the one that goes so most of these nerves, they innervate your organs located in your facial area, right, and your neck. Let's say accessory innervates your muscles, sternocleidomastoid, mastoid, and trapezius. But the only nerves that go beyond the neck region is the vagus, and vagus innervate almost all your internal organs. And this is the major parasympathetic nerve. So vagus nerve activates your organs when you rest and digest. So that's a major parasympathetic nerve, vagus nerve. But again, stop the video and read this very brief explanation of all these 12 nerves. Okay, so here now we back to spinal cord, right? Before we start talking about spinal nerves. So I already show you this picture, but let's look again. So we have spinal cord, then we have 2 roots, dorsal root and ventral root. And dorsal root has this dorsal root ganglia, where you will find cell body of sensory neurons. Then they come together forming spinal nerve, and you would think, oh, spinal nerve need to be really long, huge, but it's a short structure, because it immediately branches into 2 rami, ventral ramus and dorsal ramus. Ventral is a bigger ramus. So it has over here dorsal ramus, larger ventral ramus, and there is some other rami called rami communicants that is a part of autonomic nervous system that will be discussed in the future video lectures, right? But right now, let's look at this ventral rami and dorsal rami and see what they're gonna do after that. So you can see that dorsal rami, so dorsal rami over here, it goes to the back, and it's gonna innervate muscles of the back and skin of the back of your body, posterior side of your body. So that's a dorsal rami. Ventral rami, T2, T12 became intercostal nerves. So you see they go between your ribs, right? And they supply muscle of the ribs, anterior lateral thorax, and abdominal wall, right? So T2, T12, right? And T2, T12 is referring to your vertebrae. So you have your vertebrae like C1, C2, C3, C4, right? C7, that's a vertebra, cervical vertebra. We cover it when we talk about skeletal systems. And you have 12 thoracic vertebrae, you have 5 lumbar vertebra, all right, you have sacrum and coccyx. So when we're talking about nerve, because they exit the vertebral cavity through vertebral foramen. So if you have like one vertebra over here and you have another vertebra over here, and let's say this is T1 and this is T2, right? So here we will have, you know, this rami, specifically the ventral ramus, right? So that's one ventral ramus. Here's another ventral ramus. So we will call this one T1. We will call this one T2 in a reference of the vertebra that's between which they exit this vertebral cavity, right? So we have T1, T2. So that's what it says. Ventral rami T2, T12 became intercostal nerves, right? All ventral rami except this T2, T12 form plexuses. And we already talked about plexuses. Plexuses are interlacing nerve network. And here we have 5 of them. 1, 2, 3, 4. It says 5. Cervical, brachial, lumbar, and sacral, 4. I think somewhere I saw 5. There are 5 spinal nerve plexuses. I wonder what they mean when they say 5. Okay, so hold on a second. We will get back to it. I think, so we have cervical, brachial, lumbar, and okay, so cervical, brachial, I'm sorry, lumbar and sacral. So that's only 4. Okay, let me check. I changed it. I am so sorry for this. Yeah, where is it now? And this is because it comes with the with your book. This PowerPoint comes with your book, and of course, you know, believe me, I tried to check everything, but okay. I don't know if it's allowing me to save it or not. I don't want to mess with it because it might just mess up my video, but I will do it. Okay, so we have cervical, brachial, lumbar, and sacral. And then from those plexuses, we have systemic nerves or peripheral nerves, right? So axons from different spinal nerves will form peripheral or systemic nerves, and it's a course of a nerve plexus. So again, you have the whole plexus over here, and then you will have individual nerves that we have peripheral nerves, and they will carry axons from several spinal nerves. All spinal nerves are connected to spinal cord. We have 31 pairs total. They all mixed nerves, so they have sensory and motor nerve fibers, and they named by level at which they emerge, right? Well, this is the ventral rami, and I mean the nerves, yes, spinal. Oh yeah, you can say yes, spinal nerves, not peripheral nerves, not systemic nerves. Systemic nerves are named, you know, like radial nerve, ulnar nerve, you know, or median nerve. They have name based on a region, or, you know, like ulnar nerve because it's on the ulnar side, right? Or femoral nerve because it's in the femoral region. Spinal nerves, they are named on the levels at which they emerge. So extend outward from vertebral column, right, and innervate periphery. That makes sense. Now, here's our cervical plexus. So it's formed by rami C1, C4, and sometimes C5. And they innervate skin and muscles of the neck, ear, back of head, and shoulders. That makes sense, right? You're right there in the cervical region, so that's a good, you know, organs to innervate. One important nerve that emerges from the cervical plexus is phrenic nerve. It's a major motor and sensory nerve of the diaphragm, right? That's the one that You know, you guys make sure you know this one. So phrenic nerve comes from cervical plexus and it's received fibers from C3, C5, right? That's the fibers of the ventral rami. Brachial plexus formed by ventral rami C5, C8, and T1. Sometimes even C4 and T2. It gives rise to the nerve that innervates the upper limb. And this is the one that has like really complex structure. And so let's look over here on the diagram. So here's our C5. This is our T1, right? So here's C5, here's T1. And then we have our rami, right? So that's our ventral rami. Right here, 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 and here. And then rami, they form trunks. We have upper, middle, and lower trunk. Then trunk, see how the part of this trunk goes to the posterior side, here's to the anterior. So they form divisions. And we have anterior division and posterior division. So you can see nicely here how they interlacing. And then division form cords. Like, and we have lateral cord, medial cord, and posterior cord. And then from cords, we have our peripheral nerves. So over here, we have muscular cutaneous, axillary radial, median, and ulnar. So this is the ones that go down to your upper limb and innervate your arm and forearm and your hand, right? So, so that's a brachial plexus. And here's our major nerves that major nerves that merge from brachial plexus: axillary innervates deltoid, teres minor, and skin and joint capsule of the shoulder. Muscular cutaneous innervates the bicep brachii and brachialis and skin of the lateral forearm. Median innervates the skin, most flexor and pronators of the forearm, and some intrinsic muscles of the hand. Ulnar supplies the flexor carpi ulnaris, part of the flexor digitorum profundus, most intrinsic muscle of the hand, and skin of medial aspect of hand. And radial innervates essentially all extensor muscles, supinators, and posterior skin. So, so axillary over here, that's your deltoid, right? And skin or, and, you know, joint capsule of the shoulder. Muscular cutaneous is, here's biceps brachii and lateral part. Median, almost everything over here is median nerve, and almost everything in your hand is ulnar nerve. And on the posterior side, you have radial. Right, so this is not all of the nerves, but that's a major one. So make sure, again, you pause the video here and you try to memorize what part of your arm is innervated by which nerve. So make sure you show it on yourself, and kind of like when you see the region, try to remember what nerve bring your responsible for sensation over here of your skin and for movement of that muscles. Right, so over here you can see the diagram that tells you. So here's the median nerve right in the middle, right, of your arm and forearm. Then ulnar nerve will be on the ulnar side, right? Then a radial nerve gonna be from the posterior division, and muscular cutaneous is this one here that innervates your bicep brachii muscle. Right there. Okay, and lumbar plexus arises from L1, L4, and innervate thigh, abdominal wall, and psoas muscles. And two major nerves are femoral nerve that innervate quadriceps. That's the muscles on the anterior side of your femoral region, and skin of anterior thigh and medial surface of leg. Obturator nerve passes through the obturator foramen to innervate adductor muscles. Adductor muscles on the medial compartment of your thigh. So you guys should remember this from from the muscular system. So over here we have L1, L5, right? And that's our lumbar plexus. And what they give you, they just give you kind of like femoral nerve over here and obturator nerve that is medial to femoral. But then you can see femoral, has lots of branches over here, like a saphenous that go way down, and saphenous is your superficial, and it's a mostly for cutaneous sensation, for sensation of your skin. And then we have anterior femoral over here, we have lateral femoral nerve. Then sacral plexus arises from L4, S4, and it serves the buttock, low limb, pelvic structure, and perineum. And the major nerve is sciatic. That's the longest and thickest nerve of the body. Innervates the hamstring muscles that are posterior side of your thigh, adductor magnus, and most muscles in the leg and foot. Now, sciatic innervates most muscle of your leg, not femoral, right? And sciatic, when it reaches to the level of your kneecap, it's divided into two nerves, tibial and common fibular. So over here you can see that's our big sciatic nerve. And here when it comes to popliteal region, right, it became tibial, right, and common fibular nerve right there. And the most it innervate your leg and foot. And there is another interesting nerve over here, posterior femoral cutaneous, this one on the lateral side. And you would think like femoral, it comes from the lumbar plexus, right? Like we have, our major femoral, we have lateral femoral, anterior femoral, but posterior femoral is from sacral plexus. Okay, so now over here you can see that plexuses can be classified by development, response, complexity. Oh, I'm sorry, plexuses, reflexes. I'm sorry. What I'm doing here? Oh yeah, okay, so we're done with this part. Now we're gonna talk about reflexes. Yeah, okay. So I'm like, well, how the plexuses are classified? Okay, now what is a reflex? Apologize for that. So let's go here for a minute. Now, reflex is a rapid, predictable, involuntary response to a stimulus, right? We have different type of reflexes. And we have somatic reflexes, we have visceral reflexes, right? So that's what it says over here. So we can have innate or acquired reflexes. Innate means you're born with them, right? And even, the newborn baby can be tested on these reflexes, like Babinski sign syndrome or a Babinski sign, when they kind of tickle your soul and see, how you react to it. So something that you're born with. There are acquired reflexes. Now, one of them is, for example, even you're driving. Very often you drive by reflexes now because it's so learned and so many times repeated tasks that it doesn't require your constant attention and constant consciousness process of this reflex. Also, when you learn how to go to the restroom, right, for number one or number two, instead of doing it in your diapers, that would be your acquired reflex. Also, it can be somatic or visceral reflex. It can be monosynaptic, polysynaptic, spinal, or cranial. This I will go over this diagram in more detail in my third video when we cover physiology instead of anatomy. So right now we're just gonna get to this last slide. So this is reflex reflex arc. and it's composed of several components, right? We have receptor. This is where we receive stimulus. We have sensory neuron, integration center, motor neuron, and effector, right? So let's look at it, and then we get back to that slide. So for example, if somebody uses a needle to hurt you, right? So they're gonna, use this needle to punch, right? Punch in your skin, right? Anyway, so somebody hurting your skin, you feel this sensation. So that's your stimulus. So pain now is your stimulus. Then you have sensory neuron. So you will have receptor. So we'll have, for pain, it will be free nerve endings, right? So pretty much going to be your dendrite right over here. So that's, we don't even call it dendrite, we call it peripheral process. So we'll have this peripheral process of this sensory neuron that is your receptor. Sometimes we have a special receptors, right? We might have, like rods and cones, for example, in your retina. Those are, very specifically designed, build receptors for vision. Or we can have lamellar corpuscles. So it's a nerve ending, and it has some layers of connective tissue around it. Right? So either we have a special receptor, or it's just a nerve ending. Like in this situation, it's a nerve ending, and you feel this sensation. You have this sensory neuron or afferent. Let's put over here the name. Afferent neuron, that is sensory neuron, that bring it to your central nervous system, specifically spinal cord. Now, spinal cord will be your integration center, right? So the spinal cord is your integration center, and you will have like interneuron. Sometimes you will not even have interneuron. You don't need to have interneuron all the times, right? But in many situations you have this inner neuron, but your integration center now spinal cord. And now the signal is sent to a motor neuron or efferent. And that efferent neuron innervates your skeletal muscles, and skeletal muscles are effectors. And you will move your, your body part away from this painful stimulus. Right, so you can also see how we have the sensory neurons that are unipolar, right? That's unipolar, and this would be in this ganglion. Remember that's a ganglion. And the motor neuron, see where the cell body of motor neuron is? In a anterior gray horn right there. So here we would have another root, right? So this will have a ventral root and dorsal root, and then they would form spinal nerve, and then spinal nerve will be divided into ventral ramus and dorsal ramus and so on. But here's our afferent or sensory neuron. So again, we have receptor right there. So that's a receptor. Then we have afferent neuron or sensory neuron. Then we have integration center, spinal cord. Then we have motor neuron, and effector is skeletal muscle. So now let's look over here. Receptor is the site of stimulus action. Sensory neuron transmit afferent impulses to CNS. Integration center can be either monosynaptic and polysynaptic. This is the polysynaptic already, because we have 1, 2 synapses. And it can be even, it can be your brain or your spinal cord, but it's need to be region of CNS. Then motor neuron conducts efferent impulses from this integration center to effector organs. And now look, your effector organs are either muscle fiber or gland cell. So effector organs can be only muscles or glands. It can be skeletal muscle, can be cardiac muscle, smooth muscles, and it can be different type of glands, right? It can be your sweat glands, It can be your lacrimal glands, like your tears. It can be even your glands that secrete digestive enzyme, but is the muscles or glands that will respond to these different impulses, but contracting or secreting, right? And this is our arc, reflex arc, right? So, the last slide over here for anatomy part, and the rest of the PowerPoint will be covered in the third video. Spinal reflexes and how they important in a how they clinically can be important, right? Spinal somatic reflexes, integration center in the spinal cord, right? That's what we call spinal. Somatic means that effector gonna be a skeletal muscle, right? So effector are skeletal muscles. Testing of somatic reflexes is important clinically to assess the condition of the nervous system, right? So, and you probably at some point of your life you were tested for spinal reflexes, all right? And the spinal reflex will tell us a lot about your motor neurons, right? And your sensory neurons, and about your tracts in the central nervous system, about all these ventral dorsal roots of the spinal nerve, right? So that's, so we're testing how, how this arc is working. Is it working correctly, or there is some problems with that? Okay, so anyway, we do have a couple more slides to cover, but that's for our next video. So again, we were covering introduction to the peripheral nervous system. All my lectures, because I teach the kind of like low division classes, so it's mostly basic information. It's just a foundation for you to build more and more knowledge on top of this foundation, right? So thank you for watching, and I hope it was helpful.